While Americans were consumed by all the political drama and the recent disasters and tragedies, United Healthcare was once again up to no good. And in this video, I'm going to tell you all about some of the absolutely heinous things they've allegedly done since Luigi took out their CEO. And we're going to start off with a story so ridiculously evil that most people don't even know how to feel about it. In a recent post, Dr. Elizabeth Potter shared this with her fellow Americans.
It's 2025 and insurance just keeps getting worse. I just did 2 bilateral deeps and 2 bilateral tissue expanders for patients. And I've never had this happen before, but during the second deep, I got a phone call into the operating room saying that United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. And, said I had to call right now. So I scrubbed out of my case and I called United Healthcare, and the gentleman said he needed some information about her, wanted to know her diagnosis and whether her inpatient stay should be justified.
So basically what she's telling us is that the corporate savages, United Healthcare, couldn't even wait until the patient had recovered from the surgery to find out if they could deny her claim. Now, Dr. Potter tried to explain the situation to this guy, and this was his response.
And I was like, do you understand that she's asleep right now? And she has breast cancer? And the gentleman said, actually, I don't. That's a different department that would know that information. And I was like, well, she does need to stay overnight tonight. And, you have all the information with you because I got approval for this surgery, and I need to go back and be with my patient now. But, yeah, it's out of control. Insurance is out of control. I have no other words.
So apparently, he didn't even know why that patient was in the hospital, and he called her physician to see if her claim could be denied. At this point, I'm not even sure there are real human beings on the other end of the line deciding if a patient gets help or not. Now, this video went viral, and as you can expect, people were outraged. One user commented, "Having to scrub out of a procedure to take a call for insurance reasons is absolutely insane." And another one asked something which was on everyone's mind. Why does an insurance company have the power to interrupt surgery? I mean, it's a legitimate question. Why did this doctor have to call an insurance representative during surgery? Well, this is where things go from being disturbing to absolutely infuriating. Just listen to what this other doctor has to say.
So apparently health insurance companies have not learned their lesson from the most recent events that took place in the streets of New York. They're getting more creative about how to deny your claims or just not authorize your treatment at all. I'm going on information given to me by Blue Cross. I am a physician. When we physicians ask for a treatment to be authorized by an insurance company and they deny authorization, what happens at that point is that we are asked to do a peer-to-peer review, meaning that we, the doctor asking for the treatment, have to speak with the doctor who is employed by the insurance company, who is there only to say no.
So the physician treating you will likely have to convince a doctor employed by the insurance company, or you won't receive any help from them. I mean, I don't know about you, but this system really looks custom-made to screw over the patients. But folks, you better buckle up, because things are only going downhill from here.
Now, this always has taken place on a scheduled call. And it has to be scheduled around the insurance company doctor's schedule, not the doctor who's actually working and seeing patients. Because God forbid we inconvenience the insurance company. But now, Blue Cross is saying that they will only do their peer-to-peer reviews by calling the doctor who is asking for the treatment to be authorized. And they will only call once. And they won't tell you when they're calling. And they won't tell you what number they're calling from. So if you're a doctor seeing patients and you have your phone on Do Not Disturb because you're seeing patients, or you just don't answer numbers that you don't recognize, and you're seeing patients and you don't want to interrupt a patient visit, you're going to miss the call. And guess what? The treatment will not be authorized.
At this point, we need a Senate or congressional committee to investigate this and find out how we even allowed these companies to rig the system in this way. I can't even guess just how many claims must get denied because the doctors were not there to pick up a call. Dr. Potter later shared how United Healthcare responded to her video.
It's Dr. Potter. United sent me a letter, which I'm going to share in its entirety here, and they denied my patient's overnight stay. I'm going to let their words speak for themselves. What I have to say is that my words were true, and I was honest in my statement in the video. And I'm sure I'll have questions after you read United's letter, and I'm happy to respond to those in some other forum. I'm not going to be silenced by threats when it comes to speaking out for my patients and for my ability to take care of them and for what's going on in the healthcare system. If I don't speak out, then I lose. I lose my integrity, and I lose my voice, and I lose the opportunity to make a difference. And although it is a bit intimidating to have a company like United send a letter like this to me, I know where I stand. I'm a woman taking care of women who are affected by breast cancer. And I know that I do that with all of my heart and in a way that I can be proud of. And I spoke up when I needed to, and I'll keep speaking up.
To her credit, she also shared the notice she received from United Healthcare, and in this notice, they mention a couple of interesting things. First off, they claim that they had to call because Dr. Potter made a mistake earlier, which meant the patient didn't get approval for the stay at the hospital. They also say they never asked her to leave the surgery room to take the call. However, they do mention that they had to call her immediately because Texas law only gives insurers 1 day to review concurrent cases and provide a reasonable opportunity to discuss the plan of treatment for the patient before issuing a denial. Now, if this really is the case, I think every Texas citizen should ask their local lawmaker to take a look at this situation and see if something can be done about it. The health insurance industry has become the public enemy #1 in the last few years, and we cannot let this situation go on for too long. And while we're on the subject of insurance, well, I unfortunately have some more bad news for the people of California. State Farm, which insures 20% of the houses in the state, is seeking emergency rate hikes of up to 38% for California homeowners, renters, and landlords. According to the reports, the company is demanding a 22% increase for homeowners, a 15% increase for renters and condo owners, and up to 38% of an increase for rental dwellings. And since the average annual home insurance from State Farm costs around $1,935, homeowners are looking at a $200 annual raise in their insurance prices. But this is nothing compared to what's coming. In California, a 1988 ballot initiative known as Proposition 103 limits how much insurance companies can raise their rates. It's the only thing that stops these companies from raising their premiums by thousands of dollars. However, many analysts are warning if this situation continues, insurance companies could go bankrupt, which will only make the situation worse for homeowners in the state. So for now, it looks like either the federal government comes to the rescue or California takes on more debt to pay people for the rebuilding process. Now, moving on, I want to talk about a strange phenomenon taking place in states like North Carolina where people are claiming to hear mysterious noises.
I saw something on the internet last night late, about these noises that sound like trains or booms. Now, like a boom could be thunder, it could be a jet, it could be a lot of things, right? But the thing that sounds like a train usually sounds like a train, right? It's a distinct noise. And my wife was telling me about that, and I hadn't really seen it, so I kind of looked into it. It's in North Carolina, Kentucky, New Jersey, all over the place. And then I started thinking, wait a minute. We were sitting on the back porch at Christmas, and my dad said, I didn't know you guys had a train out here. And we're like, we don't have a train. There's no train tracks anywhere near my house. And it sounded like a train way off in the distance. Now, I don't know what the heck that was. I didn't think much about it, and I still don't really think that much about it. But it is odd, right, to these noises that sound like trains, and there's no freaking train around. And I know what a train sounds like. You know what I mean? So if you've had a similar experience, jump on here and make a comment. I don't know what it is. And again, I'm not worried about it because I know how the story ends. I know where I'm going. And I just wanted to jump on here and say, if you're not right with the Lord, get right. You want to get saved on this side of his return. Because once he comes and takes us home, it's going to get ugly.
Now look, I can't say I fully trust these stories, but a lot of people seem to be hearing the same thing. And we already know how directed energy weapons can make you hear strange noises.
You were attacked. Yes. You were attacked by an energy weapon.
Yes, a directed energy weapon. My ear started hurting. I started having vertigo. The room was spinning. My head started pulsing. Like, it hurt so badly. And I had a ton of pain in my left ear. And my ears started ringing. And I thought I was going to pass out. I was serving in Africa, and I experienced an anomalous health incident in my home on a Saturday night. And I heard a weird noise. It was a really weird sound that I'll never forget it. And after about a second or two, I felt it in my feet, kind of like the reverb from a speaker.
And North Carolina has already seen quite a bit of testing, as we all know. So I'll just ask you to be careful when trying to look for the source of these noises, since you might end up suffering life-changing injuries. Now, I'd like to end this video by sharing a very interesting story with you.
Do you guys remember this administration hiring tens of thousands of IRS workers so that they can come after us for back taxes and audits to try to generate more revenue for the country? Only to find out from 2021 to 2023, there's almost 6,000 IRS workers that owe about $50 million in back taxes. You hired these people to come after us, and your own employees owe $50 million? Ain't that about a... Oh, it gets better. Hold on. And even though the IRS has the ability to fire these people because they owe back taxes, only 20 of them have been fired. And look at this. You're telling me that some of these people have had misconduct, sexual misconduct, inability to perform duties, and 282 of them have been rehired? You're coming after us when your own house is a mess? I can't wait for Trump to start cleaning house. This is absolutely ridiculous.
Since we finally have started cleaning house, this video has gone viral on X, and people are really trying to push President Trump and Elon Musk to look into the IRS. Now, first of all, I think Elon is likely already investigating the IRS, considering how suspicious he is of every agency out there. Also, we now have a president who hates taxes, so who knows, the IRS might also be on the chopping block soon. Now, what do you guys think about this United Healthcare situation? Also, if any of you live in California and have been affected by the fires, please tell us what kind of assistance you've received so far. I can't stress enough how much I enjoy your comments, so please keep sharing them with everyone in the comments section below. I truly appreciate you taking the time to watch this video, and I hope to see you in the next one.